Alright, knock, knock. Hi, I'm Nicole. I'm your student nurse today. Dog privacy, wash my hands. Can you please state your name and date of birth? Alright, matches perfectly with your wristband. Alright, so today I'm going to be giving you your potassium through your central line, and then your morphine along through your central line, and also I will be doing your dressing change. So I'm going to start with your potassium chloride, and alright, so we have potassium chloride, 10 milliequivalents in 100 milliliters, normal saline. It's not expired. Its expiration date is 6/2035, and the order is stat, so I'm giving it right now at 11:45. So I have Francis Christensen. Allergies are betadine and codeine. Potassium chloride, 10 milliequivalents in 100 milliliters of normal saline, IV piggyback, not expired, and given at 11:45. Francis Christensen, allergies are betadine and codeine, and this is potassium chloride, 10 milliequivalents in 100 milliliters normal saline, not expired, and IV piggyback through the central line. Alright, I think I'll do it one more time. I have Francis Christensen. Allergies are betadine and codeine. Potassium chloride, 10 milliequivalents in 100 milliliters normal saline, IV piggyback, and expiration date is 6/2035. Alright, so my checks are done. I have Francis. I'm going to get the tubing out and inspect the tubing, make sure the clamp is closed. I'm inspecting for any holes, kinks, or anything like that. Okay. So I'm going to hang this clamp up here. And then I'm going to be giving this at 100 milliliters per hour per the drug book. Oh, and I'm also, before I spiked it, I'm inspecting the bag and making sure there's no leaks or any clumps. Okay. And we have normal saline running right now for the order, so I'm going to clean this site. Okay. 15 to 20 seconds, or whatever your agency protocols are. I'd take off the cap. Okay, it's clamped. So now I'm going to backflow since they are compatible. Getting all the air out of my line. Not filling up my chamber all the way. Okay, so now I'm going to program the pump. Oh, I reclamped it. Okay, so I'm going to go to channel select, secondary, look for potassium chloride, and it doesn't look like it's in here. Okay, so I'm going to go there. My rate is 100 milliliters per hour. volume, it's 100 milliliter bag. So I'm going to put 100, and when it's done, it will pull from the normal saline. So I'm going to hit start and undo the clamp. And then I'm going to watch the drips. Make sure it's pulling from the, there we go. Now I'm going to watch the drips. Okay. So I'm going to wash my hands, and now your potassium is running through your line. Now I'm going to get your morphine ready. And morphine and potassium and normal saline are all compatible, so I'm going to be running it through the same line. Alright, so I have the morphine. I'm going to clean it off. (15 to 20 seconds, or whatever your policy is. Okay, I'm going to let it dry. Attach this. And then I did the math, and it's going to come out to 0.4 milliliters. So I'm going to draw 0.4 milliliters of air. And this is dry, so I'm going to insert it. Now I'm going to draw up. Point 4. And there's a big air bubble. So I'd make sure I get that out. Okay. So I have 0.4, and there is some air bubbles, but I would get those out. But for this purpose, can you see it?
I think you can.
It's so hard.
Feel like you can. Let's get a couple angles in here.
I don't know if you need me to move.
I think that's good.
Yeah.
I think that's good.
Okay.
Looks pretty clear.
Alright, so now that I'm dose accurate, I'm going to do my checks. So I have Francis Christensen, and I have morphine 2 milligrams IV push every 1 hour PRN, and she hasn't had it for 2 hours. So I'm going to give it to her at 11:52. And then this is morphine 10 milligrams per 1 milliliter. I did the math, so it's 0.4. Francis Christensen, she's allergic to betadine and codeine. Morphine 2 milligrams, which is 0.4 milliliters every 1 hour. So I'm giving it to her at 11:52. 0.4. through her central line. Francis Christensen, allergies are betadine coating. Morphine 2 milligrams. Morphine 10 milligrams per 1 milliliter, so that would be 0.4, and I have 0.4, and the expiration date of the morphine is 12 of 2030, so that's not expired. All right, so now that I have this, I put on my label of morphine. Okay, so now I'm going to wash my hands, put on some gloves, take a look at the site, and I would have done this before I started the potassium chloride, but I'm noting no redness. Is it tender? No. There's no swelling or infiltration. So now I'm going to clean this Y port because it's compatible with potassium and normal saline. Now I'm wearing gloves, and then some side effects that I will be watching for with this morphine is respiratory depression, constipation, any dizziness or nausea, and then also with the potassium running, I'm also looking for abdominal pain, nausea, diarrhea, and vomiting. So let me know if any of those occur. I'm going to take off this cap. And then for the drug book, morphine needs to be pushed 4 to 5 minutes. So I'm going to push it at that rate. But for this, I'm just going to give it. Observing for any side effects. Carbon. Okay. Remove my gloves, wash my hands. And I'm going to clean up a little bit. So observing for any adverse reactions. And then she needs her central line in because of her electrolyte imbalances. We are treating that with potassium chloride. Okay, so now I'm going to do your central line dressing change. And are you able to wear a mask while I do this to help prevent any infections? Yes? Okay, great. So I'm going to wash my hands. Wash my hands again. Okay. So then I'm going to, I wash my hands, open this up away from my body. Okay. And put on my mask. Wash my hands. Put on clean gloves. And then now I'm going to remove the dressing because I've already inspected the site and there's no redness or tenderness. And I'm not turning my back away from my sterile field. All right. Gonna get up all the edges. All right, now I'm going to pull the dressing towards the insertion site. Okay, I'm going to inspect the dressing for any drainage, and there is none. Okay, so now without touching, I'm going to look at the site and I'm looking for any redness or infiltration or swelling or anything like that. Okay, so I'm going to remove my gloves, wash my hands, and I have my sterile gloves right here. Or I guess I can. Okay, so I'm going to remove my gloves. Damage. Okay. Okay, so now I'm sterile. My glove just brushed the curtain, but then I would change into new sterile gloves. So now I'm going to get my Q-tip. Okay, and I'm going to clean around the site. Garbage. I'm going to take I'm gonna get my tweezers. Alright, so now I'm going to scrub for 30 seconds. And I'm gonna go under. Okay, garbage. So then I would let that dry and do a skin prep. The edges. Garbage. Alright, now I have my Tegaderm. I'm going to remove the back garbage. I don't need that anymore, so it's okay that it landed in there. Without touching the center, I'm going to apply this. Alright, looks good. Now I'm going to get the label off, and then on, whoops, these guys are way too big. Okay, and then on my label, I would put my name, the date and time it was changed, and then the needle gauge, and then I'm going to put it here to help with the dressing from coming up. Alright, so now I'm going to remove my gloves, wash my hands, and make sure, remove my gloves, wash my hands, take off my mask, wash my hands, take off Francis's mask, garbage, wash my hands, and then I'm going to lower the bed, make sure she has her call light, bed's locked, if she needs anything else, and then I clean up my area, wash my hands, leave the room, and then I would document date and time. I document potassium chloride, the amount given, and then the morphine and the amount, and then dressing change and the time of each medication given, and then the time of the dressing change. And then I would document if there was any redness or pain or anything like that to the site or to Francis, and then any drainage or anything on the old dressing. But I would also go back into the room and identify the patient, and then measure 6 inches above. I'm looking to make sure it's around the same size. Okay, and then I'd want to measure the external catheter length, and then I would make sure that it's not over like an inch of difference of the baseline, because otherwise I could indicate an infection or infiltration happening. I would also document those numbers that I got, then wash my hands, and then patient consideration would be if I had an infant, the potassium chloride order might be smaller, and then if for the dressing change for central line chlorhexazine, it's a cleaning solution, might irritate an infant's skin, so you would have to look at your agency's protocols and see what you can use for an alternative. Okay, I'm done.